Hello, everyone. You're very welcome, esteemed guests, colleagues, and friends. Lovely to see you all here this evening. My name is Vivian Brady, and I'm Director of Midwifery here in the school, and it's my pleasure to open the proceedings tonight. I'm delighted to welcome our guests this evening. We have joining us our Provost, Dr. Linda Doyle. We have technical, research, professional and academic staff across the school and college. We have student representatives and students. And we have clinical colleagues who work alongside our nursing and midwifery students and directors of nursing and midwifery. You are all very welcome. I would like to extend a warm welcome also to the members of our international advisory group that are joining us online. And I'd also like to welcome Anya Lynch, who is our Chief Nursing Director of Midwifery from the Dublin Midlands Group, and also a member of the International Advisory Group. There will be two speakers here this evening. The first is our Provost with her opening address. And this will be followed by our Head of School, Dr. Fintan Sheeran, who will speak to the school strategic plan. Following that, we will adjourn to the foyer for some refreshments and a little celebration and a way to get to know each other a little bit better. Now, without further ado, I'd like to please welcome our Provost, Dr. Linda Doyle.
Thank you, Vivian. I'm absolutely delighted to be here to welcome all of you colleagues and special guests. I suppose what I want to start by saying is just congratulations. I can see from looking at your strategy the amount of hard work that's gone into this. And I know there's 2 years of work. I know there's lots of reflection, lots of meetings and lots of input. And I think it speaks to the passion of the school that you care enough to put that amount of time into things. So just start by saying congratulations that you've done this and you've achieved this. And it's just fantastic. I know that Fintan's going to be talking to you about the values, but to me, when I was reading the strategy, I thought it was really important that you did start from those values. And two that really stood out to me were the humanistic engagement and the social justice. And I think they're fantastic words. And I think they're really kind of powerful words to have at the start of your strategy. I was just talking to Fintan as I was coming in, and I hope you don't mind me saying that you said you were nervous, and I was saying why. And to me, I think it's wonderful that you are, and I think it's wonderful that you're nervous because it means that you care about this. And I know that you know that this is kind of a big thing for the school, and behind the pages and the words are, as you spoke to me about earlier, Fintan, the community that is here. So I think it's to be applauded that you feel like that because you care and you want actually something great to happen with the strategy. When I was reading through it, I mean, you know, you only have to look at the opening, the heading of it, and the phrase transforming healthcare to know that you want to be ambitious. And to me, that's really, really important. That kind of thinking is just so key, that you're not here to just leave things the way they are. You're here because you're looking around you and you want to, you know, you want to do something different. And, you know, when I look at, I suppose when you speak to people in general out there, probably healthcare is one of the major issues of our time. So if you look, I suppose, at some of the healthcare systems in the world, especially in the Western world, where there would be healthcare systems that we would have held up as exemplars, and we see those systems crumbling now, I think most people, I think, are at a point where we're kind of wondering how actually healthcare can be delivered in any kind of a sustainable and reliable, you know, and meaningful way in the future. So I think this question about transforming healthcare is just so key. If you go beyond, actually, I suppose, the crumbling healthcare systems we have around us, and you look at the changes that are happening or have happened, you know, I know your strategy speaks to the huge changes that have happened because of COVID. I mean, I think we all understand healthcare and healthcare systems in a different way. We use technology in a different way because of it. There's different kinds of ways of working because of it. And I think it's really important that that's kind of, I think, informing your thoughts about transforming healthcare. But there's also, and I think it's really lovely to see in the strategy that you're thinking actually about sustainability and how that kind of plays the role in transforming healthcare. I was actually listening recently. I didn't do biology in school, and I have to say I'm really bad at all things biology. But I found myself listening to a podcast about Candida auris. I don't know whether anyone has listened to anything about this recently. And I was incredibly, so this is my layperson's understanding of what I was talking about. So I was saying that this infection that you can get in a particular time couldn't exist in humans. So you could only get it in other places, other things in the world, but in mammals it couldn't exist because basically our bodies were too warm for the Candida auris to survive. But because of climate change and because of the world heating up, that Candida auris is able to actually survive in hotter temperatures, and therefore I think since 2009 has appeared in humans. And I found that completely fascinating. And that whole idea that climate change is not just actually, I suppose, there's people around the world who are in such difficult situations now because of what they're facing, but it's actually changing the kinds of diseases that you can get. So I was really delighted to see right in the heart of the strategy is the idea that, sustainability and the environment is built into everything from the beginning, because it really does hugely impact things. We know too, of course, that poverty affects everything we do. When you look at Ireland and you see the rising numbers of homelessness, when you understand that, poverty can have a kind of chemical effect on your body and change everything about you, and not to mention your life expectancy, you have to think about transformative healthcare. How can we do things differently? And then, of course, when you think of things like generative AI, it's a topic I have a huge interest in at the moment. That actually makes us think about, how do we teach in the first place? What should we even be teaching? How do we treat people in different ways? What kind of ways can we actually, what kind of new ways of thinking can we bring to all of the practices that we have? So you really are, I suppose, at this point in time where so much is changing, that transforming healthcare is kind of completely crucial. And when I look throughout that your strategy, I see things that nod to this all the time. I see you questioning about how healthcare is delivered in the first place. I see you talking about adopting innovative student-centered approaches that emerged during COVID. I see you talking about harnessing technology advances in many different ways. And I see you talking about building sustainability into your program and much more. So I think the title that talks about transformative healthcare, what you're doing in that strategy is kind of really threading that through and saying, I'm serious about this. The other thing that really struck me, and when I was reading, was, and again, it's kind of in the title here, it's the creating a better future for all. And I think that hugely speaks to, why a university is here. I always say we're here to make the world a better place. And if we don't want to make the world a better place, we might as well go home. But what I love about you care, you want to make the world a better place. But there's also a real notion about making this community better for everyone. And I think while you're continuing the ambition of transformative healthcare, you're also combining that with an ambition for your school, for your colleagues, for everyone in it. And I was actually really, really taken with when you talked about supporting and enabling staff at all levels to reach their full potential. And I think that's a wonderful thing to see in there. And when you're in a school with 17,000 students, which is pretty amazing and pretty spectacular, the numbers that you have, I think the fact that you think about community and you think about how all of that community is touched by what you're doing in the strategy is just very, very powerful and very, very impressive. I also was really, really struck when I looked at it about how engagement has played a huge role throughout the strategy. And actually, it was kind of really interesting to see that societal engagement came before teaching and learning and research and organization. And actually, I'd love to talk to you more about how you made that decision about where they went. But to me, it was something different that you decided to put things in that order. And it spoke again to this kind of idealism and belief and ideology that you do want to reach out. And there's fantastic, I loved the kind of map of the world where you're thinking about your place in the world. And a university, a school like yourselves of nursing and midwifery that is 42nd in the world, thinking in that global sense and thinking, reaching out, I think, and that engagement locally and that engagement globally is absolutely completely wonderful. I suppose I just want to end by a small few other words. You draw your pathway of how you got here on, I think it's on page 12 of, and there's lots of twists and turns in it. And I suppose what I wanted to say is, I think there will be more twists and turns. You know, the world is changing so much for the reasons I mentioned at the beginning, and we can see it all around us. So I think you could, you know, to use that phrase, lean into that. You know, I think the strategy is a fantastic point, but you shouldn't be afraid if you see new things to change and to adapt as you go along as well. And that adaptability to me stands out in the strategy as well, because I love the way, and I know there's huge changes afoot in the school. There's, because of the time the school started and because of the time we're at in history, there'll be enormous changes in staff in the next number of years. And I love the way that you're looking at that as an opportunity to do new and wonderful things, to build on the legacy of those staff that will be retiring, but also to say, okay, this is an opportunity to really drive the mission of this home. So when I read the strategy, I could see, as I said, the words community, the words engagement, you know, the ambition to make the world a better place shining out of it. And I just want to say congratulations again to everyone involved. Not every school, you know, takes the time and puts the time aside to create a strategy and puts the effort and passion and care into it. So I would congratulate you again. And then I just want to make sure I say thank you to everybody. So thanks to all the academic and professional staff and students in the school. It's great, actually. I do find every time I'm at something over here, there's always a mix of all staff and students. I think that is fantastic. A special thanks as well to staff and the linked health services providers. I do love actually your diagram where you show all of your connections, and it's really good to think about that in the round. To the school executive, and then your international advisory group. I know that you had Professor Antonia, I hope I'm pronouncing this right, Villarreal, Professor Tracy Humphrey, Professor Walter Zermans, and Miss Anya Lynch, all involved in it. So I think that's fantastic. And then, of course, very special thanks to Fintan. I think the job of head of school is one of the hardest jobs in the university. And I think there's just so much thrown at you, and in a big and complex school like this, I think the job is even tougher. So Fintan, thank you for taking the time to create the strategy and bring your school through this journey and onto what is next. So thank you very much.
So I normally speak in an unscripted way, but I have a script. But to proceed that, I want to thank you, Provost, and I want to thank you in particular for some of the comments you made around caring and around engagement. Humanistic engagement is central to this, and societal engagement is at the beginning of it, because the fundament of nursing and midwifery is human engagement. If we don't get that right, then we don't get nursing and midwifery right. And if that is our starting point, I met the first year students in Goldsmith Hall a little earlier. And one of the things I said to them was, don't forget that the core of what you will do as nurses and midwives is with the patient, with the person. So that's our starting point. It has to be our starting point here as well, I believe. You also noted that my nervousness was out of caring. And thank you for that, because not only do I care for the plan, but any care for the plan is because I care for the school. And if I have ever contributed anything in my time in this school, I would hope the one thing that I might be remembered for is contributing to the community. So I care very much about our community. I care about the people in it. And probably that came from the fact that this started off for me when COVID was in its first year. So we launched ourselves from there. So thank you for your inspiring words, and also for the interest that you've shown throughout your provostship so to date in the school. But I'd also like to acknowledge your commitment to working with me over the past years in seeking to ensure that we move forward. And when we do so, that we move forward in a way that's grounded in sustainable leadership. I want to thank you all for coming here this evening, and I'm so happy that you've given of your time to share in this important event. The school dates back, if I'm not mistaken, to 1996. which is very young in Trinity terms. But we existed before that in our roles in the various schools of nursing and midwifery, many of which had lineages tracing back to the early days of our two professions. When we came into Trinity, we came with the proud identities as James's, our Adelaide Mead National Hospital, our Children's Hospital nurses, Coombe, our Rotunda midwives, HSC, our St. Patrick's mental health nurses, Stewart's, our, as it was called, Morabbey intellectual disability nurses. But under the astute leadership of Professor Cecily Begley, we quickly became Trinity College Dublin School of Nursing and Midwifery people. That was over 20 years ago. And since then, the school has gone from strength to strength and has established itself as a national and international leader. This is in no small way due to the quality of the people who have worked in the school and also the people who are here today. We're in the time of change, and the Provost has spoken to that. At national level, nursing and midwifery practice has developed phenomenally, and the recent expert review will have a profound effect and impact on the practice and education and what that will look like in the coming decade or so. The role of COVID-19 played a part in the need for a review, and it showed us that we're part of a global reality where health issues no longer have the boundaries they used to have, as you spoke to. We're also seeing significant human displacement nationally due to the housing crisis and internationally due to war and other crises. The reality of climate change will only add to this, and we need to be prepared for the socio-political and health impacts of this. We're also passing through the normal cycle of change in the school, with many of us entering late career stage, myself included. Well, I'm already in it. This is daunting on one level, but exciting on another, as we have the potential to mentor those who will be taking the baton from us. And I'm delighted to welcome some of our new colleagues who are here today. But as we try to play our part in meeting the global and national need for increased numbers of midwives and nurses, we find ourselves constrained by the dimensions of our building and by the limit of our resources. And this is playing out as I speak. We have seen an increase in some cohorts of students already this year, which have left us with the challenge of finding classroom space. Hence the importance of a strategic plan to guide us as we seek to address these challenges and opportunities. In setting out on this strategic planning journey, we were eager that the process would be as inclusive as possible. And this has taken more than 2 years and involved many meetings, events, and engagements. It quickly became clear that the school community wanted their values to be clearly set out. This emerged from initial survey interactions with staff, and student experience and staff experience were to the fore in those. As we worked through various planning events, these arose again, and the executive had the opportunity to work on these further in externally facilitated sessions. And so central to this strategy is the statement of our values, because these values underpin how we see ourselves. They underpin how we want to conduct our business. They underpin how we want to relate to each other. And they underpin what we want to instill in our graduates by way of the attributes that make Trinity College Dublin nurses and midwives stand out. And they also underpin what we choose to do as a school, because we can't do everything. And I said that on the first planning event we had. We have to choose what we do. The values, as you've seen, are equality, diversity, and inclusion. And we're working towards Athena Swan Award in that regard. Dignity and respect, which we have restated as being central to how we treat each other in this school. Community and collegiality, humanistic engagement, compassion, social justice, sustainability, and innovative inquiry. I've mentioned leadership. I'm grateful that the International Advisory Group, the members of which assisted us in our planning, commended the school executive on its outstanding leadership. The members noted the collegial, and Liz Curtis would love this is an in-joke, the distributed nature of the leadership. Leadership is not solely invested in a head of school or in an executive. We're all leaders. And this is most likely what has been instrumental in the success of the school nationally and internationally. We'll continue to demonstrate leadership in the ongoing development of nursing and midwifery education, research and health innovation. And furthermore, as recommended by the advisory group, we will ensure that our graduate nurses, midwives and researchers will be positioned to be important leaders in nursing, midwifery and healthcare. We don't work alone though, and any concept of Sinn Féin Amháin, ourselves alone, is something that perhaps has historically positioned our professions away from other healthcare professions. Healthcare is integrated and it's interprofessional. And in this strategy, we are committed to working closely with our colleagues in the faculty to ensure that we can maximize the potential of interprofessionality in education, practice, research, and innovation. We're similarly committed to partnership with our colleagues in clinical practice, health, and social service provision. We need to strategize together and support each other. And to this end, a new leadership forum has been set up, which will bring school leadership together with partner nursing and midwifery directors 3 times per year. And we will prospectively plan around shared priorities, including, for example, how we respond together to the workforce challenges and increase retention of our students, but also retention of clinical staff. The launch of a strategic plan is not an end point, but rather a new beginning. After today, to quote our late Trinity brother, Brenton Kennelly, we begin again, knowing that every beginning is a promise. I had the joy, as I mentioned, of welcoming our incoming junior fresh students in Goldsmith Hall this afternoon. And it's wonderful to see this new generation starting on their journeys. Our strategic plan is a promise for them and to future generations of nurses and midwives. And we will now work together to bring this promise to fruition. In an event like this, we can only target the high-level details of the strategy, but these overlie the detailed objectives, targets, and timelines that have formed the research, global, undergraduate, and postgraduate elements of the strategic plan. And these are available along with implementation plans on the school's SharePoint site. As I finish, and before I do, we have the opportunity, and before we have the opportunity to share time together over some refreshments, I'd like to say thank you to those who've worked on or informed the strategic planning process. The school community, all of you, professional staff, academics, students, research staff, and all those who participated in the various stages of the process. And a special note goes out to Frank and to the school directors for their dedication and drive. Also to Ailish for supporting the planning process and Jenny for organising today's event. The Dean, the Vice Provost and the Provost, who engaged at a number of key points, particularly around strategic staffing for the future. And thanks, as I say, to you, Provost, for your presence here today and for your supportive words. Tangent. Shay Butler and Jonathan Bannister worked with us in the executive and helped us develop what that strategic plan, particularly the values embedded in the strategic plan, the vision statement and the mission statements might look like. And they reflect what you have said. They're not the executive's perspectives or my perspectives, they're the school's perspectives. Our partners, we have a large number of partners, some of whom we've worked with since the inception of the School of Nursing and Midwifery, and others who've become partners more recently. They are central to the conduct of all of our clinical programs and also sustain many of our research and innovation endeavours. Our relations with our clinical partners in particular run deep and involve connections at all organisational levels. And I'd like to acknowledge the importance of this and also their commitment to excellence in nursing, midwifery and healthcare in general. And the national and international advisors who are part of our international advisory group. Provost, you proposed the idea of an international advisory group back in April 2022. And this brought together individuals from Ireland, Belgium, Australia, and the United States of America. The group visited the school in February 2023 and met with various groups, including the Vice Provost. And they provided recommendations which have fed directly into the strategic plan. I'd like to acknowledge their critical and independent perspective, and I'm delighted that they have agreed to remain in an ongoing advisory capacity and to work with us as we start to roll out this plan. They will help us to adhere to targets and timelines. And so I'd like to bring this part of our event to a close, to say that our plan is launched, and to invite you to join us in refreshments up in the foyer, and we have an opportunity to talk amongst ourselves and hopefully celebrate reaching this point. Thank you.